Welcome back to the Elias Macko Show. Now, Quebec's health minister is claiming that progress is being made at the Lakeshore Hospital's emergency room. In a heated exchange last week at the National Assembly, Christian Dubé defended his government's handling of the crisis at the Lakeshore Hospital, claiming that most of the problems had been solved. But Liberal health critic André Fortin disagrees, and he's on the line to tell us more. Monsieur Fortin, welcome back to the program.
Good morning, Mr. Macko.
So, tell me about your take on what is happening at the Lakeshore Hospital and what the government isn't doing about it that should be done.
Yeah, well, the reason we brought up the issue with the Lakeshore Hospital last week in the Assembly is because nothing seems to be improving at the hospital. If you look at the general metrics in terms of the wait times that people are experiencing there, if you look at the occupancy rate at the hospital, it's consistently among the worst hospitals on the island of Montreal. And last week, the Gazette did an analysis of what are the worst hospitals per death rate in their emergency rooms. And the Lakeshore, unsurprisingly, is still by far, in some cases, the hospital which has the highest death rates in Montreal. That means the amount of people who show up at the emergency room versus the amount of people who unfortunately pass away at the emergency room is not good, and it's going in the wrong direction. So we asked Minister Dubé what's happening, because every time he tells us, oh, well, there's a problem, we're implementing a solution. So we sent one of our experts, one of our best managers on site. She made 135 recommendations. We're implementing the recommendations. But the metrics never seem to improve. The situation at the Lakeshore doesn't seem to improve no matter what the government does. So we just want to know, what's the next steps here? Why is nothing improving? And what is he planning to do in order to reverse course? And what we really got from him was we're just following the plan. Everything seems to be going great. Nothing to see here.
Yeah, and I really see. I've been seeing you, obviously, in your role as a health critic, and also Greg Kelly, right, who is the West Island MNA, really hammering the government on this. Now, obviously, people want the best, right? And I'm just thinking about the various levels: management of the hospital, the regional health board, the Ministry of Health. Everyone wants the best, right? Yet it doesn't play out. You know, they say the buck stops here. So where do you think the buck should be stopping when, as you mentioned, the metrics show there is an improvement, but clearly everyone cares?
There has to be, on the part of Minister Dubé, or the part of the government, there has to be a special attention given to the Lakeshore Hospital. And we can debate whether the other hospitals in Greater Montreal or across the province are doing well, but the Lakeshore is a particular case. In the last year and a half, we've gotten reports of toxic workplace, systemic neglect of patients, avoidable deaths, management that was hiding the truth from families. We gotten reports that Minister Dubé was informed of the situation and he ignored the letters from staff who wanted to improve it. So really, there has to be a special focus put on the Lakeshore, and that's why what we would like to see is if there are 135 recommendations that are out there, then we know what the solutions are. But can we have a detailed progress report as to what's being done, what the impact of these measures are, and what remains to be done? Basically, what we are hearing now is that everything that's being implemented, so the temporary ER facility, is all stuff that was already initiated before this report came place. But there are recommendations that in our mind can really have an impact. I'll give you an example. The report said, focus on hiring here. I know you've got priorities elsewhere in this just West Island, but focus your hiring here, even if it's at the expense of other places, because your impact on patients is greater here. Is that being done? Is it actually something that the CJAD West Island has focused on? We don't know, because we're getting the good old line of, well, everything's going the way it should.
How much of it has to do just with population? You know, that part of, the west part of Montreal, off island, Vaudreuil, Hudson, population booming. How much of this has to do with services and facilities that have not kept up with population growth?
That's part of it for sure. And absolutely. Comparing, for example, the death rates to other hospitals across Montreal is a bit of a tricky adventure because maybe you have an older population, maybe you have a population that is, as you said, growing, maybe you've got different needs from the people who live in the West Island. But But at the same time, the problem here is that the situation isn't improving. If it still had the worst death toll of every other ER in Greater Montreal, it would be one thing. But it were improving, it'd be one thing. But now it's getting worse and worse, and that's where Minister Dubé's job really is. He has to improve the situation and not just treat it like any other hospital.
We're with André Fortin, Liberal M&A for Pontiac. He's also the party's official opposition critic on matters related to healthcare. Mr. Fortin, let's go from healthcare to medical diagnosis. And okay. I need to ask you this. Do you have Denis Coderre fever?
Not sure what the relationship with medical diagnosis here is, but I'll give Denis Coderre credit on one thing so far in his potential campaign. He manages to draw a lot of attention, and I haven't seen anybody in the Liberal Party, but in Quebec politics in general, who's managed in 4 weeks to draw this much attention to their campaign. So good on him, and that's a positive for him. It's probably a positive for the party as well. Now, what I'd like to see from Mr. Coderre and from all the other potential candidates is ideas, because we can all be in awe of his ability to draw media attention. But if he says the wrong things, or if he doesn't have the same priorities as I do or other party members do, then it's all for naught. So that to me is the important part. I can't wait to see some of his more specific ideas on how to advance Quebec, and then we'll go from there.
And you reference it. He clearly, seems like he wants the job. He's put his name out there. Seems like most people, like yourself, you said, you're not going to run for the leadership of the party. So many people some people have been clamoring. Current Liberal Party members have said they're not going to run. So, he said a few interesting things last week, and he said one of the things that got my attention, Denis Coderre said that the current Liberal Party has gone too far to the left. And that was an eye-opener for me. I just want to get your reaction to that, because he's definitely commenting on the current state of the party. What would you say to that?
I think it's easy for us as parliamentarians, and I'll give my analysis. My colleagues may agree or disagree with this. But the current government is so bad at providing services to citizens. And we talk about healthcare, but we could talk about daycare spots. We could talk about education. They are so bad at providing the basic services for which they're elected that it's easy for us to focus on this and say, well, there's a real problem and services need to improve and whatnot. And to maybe step away from what's been our bread and butter over years and years, which is being the party of economic development, being the party that hammers that day in and day out. And so for us, for people to say we veer too far left, do we talk about services a lot? Absolutely. Do we need to focus on the economy more? I think it's part of our brand, and certainly we could do we could talk about it even more. And I think you've seen that just even in the last few weeks in the Assembly, maybe a volonté of refocusing on that issue a lot more.
Do you think a year's time we're going to have a robust list of candidates wanting to lead the Quebec Liberal Party?
Oh, I think there's definitely going to be a few more candidates who put their name forward. Some of them have contacted me, and I said it myself in past interviews that I was out there looking for candidates, and I think there's a lot of people who are seriously considering it now, who have, in my mind, good economic backgrounds that could help position the party well for the next election. So I think there's going to be more than Mr. Coderre just on the starting blocks, if that's the case.
Mr. Fortin, thanks so much for your time this morning. Appreciate it.
All right. Have a great day.
André Fortin is the Liberal M&A for Pontiac and the official opposition critic on healthcare matters.